Do your legs feel unusually heavy or swollen, like you're wearing invisible boots all the time? Or have you noticed a limb growing larger over months, making it hard to walk or wear shoes? These could be signs of a disease called lymphatic filariasis, often known as elephantiasis. It's not common everywhere, but in some warm, tropical places with poor sanitation and many mosquitoes, this illness quietly spreads. It damages the body's drainage system, kind of like when a sink gets clogged and water starts pooling. Over time, that leads to big swelling, especially in legs or arms. The name elephantiasis comes from skin turning thick and rough, like an elephant's. The scary part? Many people don't feel sick at first, so they don't realize they're infected until swelling appears, sometimes years later. So what actually causes this? It's tiny worms, yes, worms, too small to see without a microscope. 3 types of worms can cause it, but the most common ones are called Wuchereria bancrofti. How do they get into the body? Mosquitoes carry them. Imagine a mosquito bites someone who already has the worm larvae in their blood. That mosquito becomes a flying delivery service for the worms. Then it bites you, and bam, worms sneak into your skin. They travel to your lymphatic system, a network of vessels that helps fight infections and drain extra fluid and grow into adults. These adult worms live for years, having worm parties in your lymph vessels, causing blockages. No, they don't bite your insides, but their presence messes up your body's drainage, leading to swelling and damage. Now, what does it feel like to have this disease? Many people say, "I feel fine in the beginning." But inside, the damage is happening. Some feel fever or chills when young worms flood the blood at night. Yes, they're night owls. As it gets worse, you might notice one leg or arm swelling a little, then a lot, like going from a size 10 to size 20 shoe. The skin gets thick, hard, and bumpy. Some people say it feels like carrying a sack of potatoes on their leg. It's not only painful, but can make walking, working, or even getting clean really tough. Women might face shame if swelling happens in breasts or genitals. Men can get swollen, painful scrotums. These changes hurt not just the body, but feelings and self-confidence too. First, they ask about where you have lived. Have you been in tropical areas with mosquitoes? Then they check blood, but here is the fun part: you must give blood at night. Why? Because the baby worms, microfilariae, come out in the blood mainly when mosquitoes are active, after sunset. A lab looks at the blood under a microscope to spot them. There is also a quick dipstick test, like a pregnancy test, that checks for worm proteins. If positive, treatment starts early. For active infection, doctors give a medicine called diethylcarbamazine, DEC, which kills the worms. In later stages with huge swelling, you cannot remove the damage, but you can stop it from getting worse. Daily cleaning, elevation, exercises, and special bandages help reduce swelling. It is like unclogging that sinks slowly and keeping it clean. Good news, we can stop this disease before it starts. Ever used a mosquito net while sleeping? That's one of the best shields. These nets, especially if treated with insect-killing medicine, block infected mosquitoes from biting you at night. Also, spraying homes with safe insecticides, wearing long sleeves, and using mosquito repellent help. But the biggest weapon, mass drug administration, MDA. What's that? Once a year, entire villages in high-risk areas get free medicine, like DEC, albendazole, or ivermectin, even if they feel fine. It's like a community-wide shower pill to wash out the worms before they grow. If everyone takes it, the mosquitoes can't find worms to pick up, and the cycle breaks. Think of it like vaccinating a whole village, but with pills instead of shots. Scientists aren't stopping. Recent efforts focus on stopping transmission faster. New studies use drones to map mosquito breeding sites in swamps or puddles. Talk about high-tech tracking. Also, better quick tests now detect infections earlier, even without night blood draws. Some researchers are testing new drugs that kill adult worms more effectively. current ones mostly hit the babies. Another cool advance, smartphone apps help health workers log cases in real time, so outbreaks can be stopped early. In 2023, the World Health Organization fast-tracked support for countries close to eliminating the disease. Places like Sri Lanka and the Maldives already beat it, proof that with teamwork, this ancient disease can be retired for good.